everyone. This is Dr. NAINAMD Fusion of Science and Beauty. Welcome to my show, and I want to welcome my first guest. This is Mr. Mike Mccann. He's the CEO of HeartSmart. It's a company that is amazingly progressive. You know, in anti-aging and regenerative medicine, and being my passion to really get the knowledge out there, there's a lot of heart disease, as you all know, that we see, correct?
Correct.
And a lot of times it's based on, and I think what the audience is just familiar with is saying, they go to the doctor and they say, hey, the doctor said my cholesterol results were normal. This is great. And they feel so happy. And what I have to educate them is that, wait a minute, just because your cholesterol is normal does not tell me that LDL, when you split the cholesterol right into the good and the bad, well, if your bad one is supposed to be less than 100. But let's just say that cholesterol, which is less than 100, okay? Well, let's just say you profile it further, and it's composed of small, dense particles, or it's got this something called remnant lipoprotein, or it's got this particle number is really high. That's a time bomb. That's a time bomb waiting to happen. That's all the things that you don't want. Versus if that LDL that was less than 100 was more of a high dense or a low particle number. For example, let's say I have a LDL of 130, okay? I'm higher. I should be like doing something. And you have an LDL of, let's say, 100, okay? But if yours was the small, dense, and it was really, you know, all the things that I talk about, you're the time bomb, not me. And people don't understand that. Is how do we figure that out? It's a misperception simply to say, hey, my LDL number is like less than 100 and it's great. No, there still could be serious heart disease. And your company, I readily use this company in my clinic because I think it's phenomenal, the technology that you've come out with to be able to identify much early on before an event occurs, like before a heart attack or before an obstruction to the arteries that the patient becomes really symptomatic, that you're able to kind of say, wait a minute, this is another test people can do, and that means that they need to, if it was abnormal, then they need to go see their cardiologist or their doctor to get further testing, right? Just
Correct.
Other than just a cholesterol.
Yes.
So please explain this technology and tell us about the different kind of plaques that there are, and let the audience know. What I want the take-home messages is that it's just not your LDL. It's not about just your cholesterol that predicts your heart disease.
Well, you're absolutely correct. 50% of heart attacks occur in people with what is considered normal cholesterol.
Exactly.
And it's the undetected disease that's the big risk factor. If we
Right.
can detect disease early, then we can do something about it through dietary changes, lifestyle, and you can actually reverse atherosclerosis, which most people are surprised to hear.
Yeah.
The HeartSmart test uses non-invasive...
You know, before you go into that, I'm going to interrupt and say most people are... why are people so surprised to hear, and why is conventional medicine so surprised that, oh my gosh, how can you possibly reverse the atherosclerosis?
Well, some people think that once they have heart disease, they have it for life.
Yeah.
But it can be mitigated, or even if you arrest progression, it's a big victory.
Yeah.
So what you want to do is protect your heart. The difficulty that most people have is that
They can't see
test,
it. Yeah, there's no
you
test.
can't see it because most of the tests are telling you what your risk factors are.
Yeah.
The HeartSmart test tells you if there's actually disease present.
And you know, going back to that before you explain the technology, when you said 50% of the heart attacks occur, well, we thought always that that's how the traditional thinking is, that you have to complete obstruction, right, of the plaque.
Right.
Well, 50%. What that means is it's known as a silent killer. Time magazine, at least I think 5-6 years ago, had an article called "The Silent Killer," and they said that it's that little bit of plaque. You don't have to have a full occlusion, but that little bit of plaque breaks off, travels, lodges into a smaller artery and causes a heart attack. So what is the instability of that plaque, right? That block,
Right.
instability of this plaque, or the inflammation that's causing the plaque to break off and lodge. And that's what your technology tests for. And that's what I think is so important to emphasize, is that's what you're looking at.
The HeartSmart uses a simple ultrasound scan of the carotid arteries, which we can image because they're very close to the surface
And the
of the
carotid
skin.
arteries are right here, right?
Right, in the neck. And then we can image that and we can see the buildup of atherosclerosis that we all get. But equally important is that we look for the presence of plaque that may be in the arteries.
And plaque is like, and describe the plaque, what plaque is.
Well, the plaque can be just a small intrusion into the lumen or the area where the blood flows. When it gets severe, it impedes blood flow and you get blockage.
Yeah.
And then that's what most people think a heart attack is from. But there can be very small plaques that are soft, that get vulnerable to rupture, and that break off and go to the heart or the brain, causing a heart attack or stroke.
They travel. It's a traveling plaque, right? It's a traveling plaque. That's the big one.
That's correct. And so by spotting this early on, then we can take measures to rectify it, and we can monitor the patient's health. And perhaps where it's more severe, you may need additional testing and be referred to a specialist. But the beauty of the test is it can be done right here in your office.
I know you do it. We do it all the time. So tell how it's done.
It's a simple test. It takes about 10 minutes.
The patient pretty much sits down, right?
Patient sits down. We use ultrasound, which is the same thing they use on babies, so there's no radiation.
Exactly, and so I know we just put the transducer. It's called a transducer. You just kind of, there's a specific way that we have to kind of like put it over the carotid artery, right?
Right, and we get a movie of the entire carotid tree, and then that's sent to our lab, and we...
And I directly send it to your lab right from the computer. It goes directly to you guys, right?
Right.
All HIPAA security, of course, but it goes directly to you.
And then we get a report back to you that also gives the patient a grade, so the patient immediately understands the state of their cardiovascular health. If we see pathology or the early stages of disease, we can take means to rectify that. Yep. But if we don't, if you get all A's, that's a lot of peace of mind.
Yeah, I mean, isn't that nice? So that, in other words, you always hear about, oh my gosh, and he had normal cholesterol levels, and look what happened to him or her, and had a heart attack. They exercised, they did this, their cholesterol was low. Well, nobody was checking for this kind of a plaque.
Right. At 70% blockage of your arteries, you can still pass a stress test, except that 86% of heart attacks occur in people with less than 70%. That's why Tim Russert died of a heart attack 6 weeks after he had a stress test, because they did no imaging.
And what if he had done this test? Who knows? Right?
Who knows?
Yeah.
Exactly. Might have saved his life, or might have identified disease the doctors would have taken differently.
And I think that's part of the anti-aging regenerative, because as we're looking and striving for quality of life issues, and as we're trying to figure out, how we can maintain our quality of life and how we can be the 50s at an age of 80, then part of that is very valuable tools is testing. Yes. I'm very critical on the kind of, even a lab test, what kind of method did they use, and how is this test done, because that is so important. I don't take just like, if a person says, okay, let's say my cholesterol level was this, it changes. How many consistently did you take a cholesterol level, let's say for like 3 or 4 times over 3 or 4 weeks? So nobody can do that. Instead, your test at least gives a peace of mind where, wow, at least anatomically I'm not seeing any unstable plaque. So I think it's a great way. So you gave me this book, which, by the way, I'm a biochemistry. It's a confession. I have to read biochemistry every day. That's my addiction. So I read this book. This is the book, and the name of the book is Beat the Heart Attack Gene. Can you just tell a little bit about what this book is? I think it's phenomenal.
Well, it's a great book that tells you about early detection of cardiovascular disease, why it's important, and the various things you can test for. And of course, one of the key things is the carotid IMT test, like the HeartSmart test, that looks at the actual state of disease. They refer to it as the cat in the gutter. It's just waiting there to pounce if you're not aware that disease is actually present.
Yeah, no, absolutely. It's a phenomenal book, and this is what actually a sample report looks like from the company. It really gives you a picture. They actually are able to identify. You're able to identify whether the plaque is kind of walk the audience through this. The ABC report card that they get.
Right, it's just a letter grade. We all went to high school. We know we're supposed to get straight A's.
Right.
But if we don't, we know that we need to study more or work harder. Well, this is the same thing. Yeah. It's saying that if we're not all A's, then we've got something going on.
Like this guy is pretty okay. You can, but this one is bad, because you can. Here is like you could have an unstable plaque.
Well, I think this is significant because a lot of times people, if they just measure the intermediate thickness of the atherosclerosis, it may not tell the whole story because
Exactly.
we see many cases like this where it's not particularly large,
Yeah.
but this happened to be a woman who had a lot of plaque. She had as much plaque as I've ever seen in like 5 or 6 places in her carotid arteries, some of which were soft. And a lot of women don't realize that the postmenopausal, they start to get a rapid thickening of the arteries wall, and they start to develop more plaque. That's why 55,000 more women have strokes every year than men.
And what, you know, isn't that amazing that it's been always a pet peeve of mine. I always, in my practice, anytime a woman complained of anything that was that I felt that could be heart issue, immediately I was doing a heart evaluation on her. So many women are just, they're just not picked up. We are so, in society, I think we're more readily to do or more apt to do a stress test on a man than we are on a female. Don't you agree with that statement?
I do, and I think women are vastly under-tested.
They're vastly
and they
under-tested.
don't recognize that what a danger heart disease is, because for every woman that dies of breast cancer, which they appropriately fear greatly, 10 die from a heart attack.
Yeah, there are more women dying of heart attack than there are women dying of breast cancer. And this is so important to realize. And this would be an amazing report. Just give me one example of someone that you might have come across that did this. And you remember the head of someone that was very
Yeah, there's a very prominent individual in the
anti-aging community.
In the anti-aging community,
Yeah.
wonderful shape. I mean, a physical specimen.
He is an amazing shape. I know him because he was my mentor.
And he has 2 stents now because we detected disease and plaque in the body that led him to go to further testing. The Heart Smart test is the first stage. It's for the early detection. And if we see significant pathology, then we can get to the cardiologist or the appropriate specialist.
Yeah.
And in some cases, we've had a woman who had 85% occlusion in one artery and 100% in another, and had never had an event. And what most people don't realize, for most people, the first symptom of heart disease is a heart attack.
Yeah.
And 1 in 4 first-time heart attacks is fatal. And for women, that's 1 in 3. As one of my clients said, the major symptom of heart disease is death.
Yeah.
So
because you don't know it. It's a silent killer. And that's why it is a silent killer. And you understand that acute death, when somebody says, oh, this dies suddenly, there's usually the main reason is a heart attack. That's one of the reasons of, I mean, unless you choke or I mean, if you have a stroke, you're not going to acutely die. But acute death sudden death is usually a heart attack.
That's correct.
And I mean, it's so important, and I think we're in an epidemic of missing heart disease.
And particularly for women, because their symptoms are so different and they're often not recognized.
Yeah, and postmenopausal women, I deal a lot with hormonal issues, so I know that a lot of the hormones are affecting women. And so many of my female patients will come to me and say, you know, they're so scared of having a heart disease because they know in their population they're at risk for that. And, you know, we go and balance, of course, I go and balance the hormones and so forth, which helps a lot in decreasing the inflammation. But really it is a lack of a lot of the hormones, lack of estrogen, lack of progesterone in the right ratios, and testosterone. Did you know, for example, that in testosterone, where are the maximum receptors of testosterone? Heart. It's in the heart. And here that's going to be a whole other show about the misperception of testosterone. So I'm so glad that you were able to come today. I think your company is one of the leading forefront companies in anti-aging and regenerative medicine. And that's why I wanted to bring you on. It's fabulous work you're doing. You're the CEO of the company. Please keep doing the good work. And I am going to be doing the testing. I think it's one of the best things any doctor can do.
Well, I appreciate your having us here.
Yes. Thank you. Thank you for coming. This is Dr. Naina. We'll be right back with my next guest, NAINAMD, Fusion of Science and Beauty. Hi, everyone. This is Dr. Naina. Welcome back to NAINAMD, Fusion of Science and Beauty. My next guest is Roxanne Faire. She's one of my most respected and wonderful clients. that's been to the clinic and pretty much had about everything done.
Yeah, pretty much. Yeah, pretty much. We started.
Tell me what did you start off with?
We started with, I had a baby, and so I wanted to lose some weight, and we started doing an in-body, which measures your body fat mass and everything.
So let me explain what a body composition analysis is. A body composition analysis is, a lot of times people in conventional medicine, is you just look at body mass index. It's based on your weight and your height. And based on that, you're either obese or overweight, and that's it. But what we start to realize is that a lot of times athletes, for example, may have 90% as muscle and 10% body fat, but yet they're going to be classified as obese. So body composition analysis got started about 10 years ago. I was the first one to have this machine. A lot of my conventional colleagues, what are you doing looking at body composition analysis? You know, it was like, what is this? And I would try to explain, well, you know, you need to know how the fat is distributed.
Right.
There's different kinds of fat, which all my clients, you know, you all educated about what visceral fat, which is all the fat that's around your organs.
Right.
And then there's fat that is just underneath the skin. So that's called subcutaneous fat. So we have different kinds of fat. We also have fat that's around the middle that's even more what we call bioactive, like it's bad fat, because it attracts a lot of inflammation.
Right.
So how do you distinguish between all that fat distribution? It's body composition analysis. And I started doing this, I would say about 10 years ago. And when I was at my other clinics, and I finally bought another machine. And one of the things I will tell you is that it was more expensive to buy this machine. I would think that it would have gotten cheaper on the way, but it's gotten more in demand, and they've raised the price up. So I ended up paying more, but it's being used in the cancer centers of America. And they're now looking at patients. It's very important for cancer patients to know, are they building muscle mass? Because it's totally in line with morbidity and mortality, meaning the more muscle that you have, the healthier you are.
Right.
Okay, we all know that. That's a simple fact. So the body mass index really doesn't tell you exactly how your fat is distributed, and it's really important to know. For example, even on a weight loss program, are you losing more fat around the middle? Or are you losing fat around the arms? I mean, patients can say they feel thin, but you don't know if they're really losing muscle mass or they're losing body fat. And that was one of the things that really surprised you, didn't it?
Right, because I got on the HCG, and I'm a person, I guess that you explained to me that I produce a lot of cortisol. So I had to lower the HCG, but I wasn't losing any weight, so I was getting frustrated. But getting on the BMI machine, body composition machine, I realized I was gaining muscle because I was working out so much and losing the fat, which was fine. But girls still want to have that number.
Yeah.
So,
but that's something we work. So what we do in weight loss, and you've experienced, is that we were first change your composition. That's exactly what we did. We increased muscle and reduced fat. Now, at that point, then we want to maybe focus more on burning, and so doing like cardio and more circuit training, so that we can start to burn that fat, so to speak. Now you've got a lot more muscle. So that's good, you've got that weight.
Right.
But if you just want to lose the weight, and then we just start burning the fat. So now you end up with a higher percentage of muscle and less body fat. So let me tell the audience what HCG is, when you did the HCG program.
Okay.
And I think it's, a lot of people do know about it. It's a hormone, human chorionic gonadotropin hormone. And this hormone is what is found in pregnancy. Women who are pregnant have a lot of this hormone.
that's why it made me feel so good.
Some women who actually go on this weight loss feel really, really good. So we really don't know the exact mechanism, how it works. However, there's certain doctors who have, Dr. Simon was one, and a couple of other doctors who have done research on this and introduced this with a 500-calorie diet. And people start to lose weight. The way I do it differently is I don't use a 500-calorie diet.
Right.
I don't believe in 500 calories. I think it's great that people lose weight on the HCG and the 500-calorie diet, but each time that they're going to gain the weight back a lot of times, and then the next time around it's going to be more difficult, because that 500 calorie and eliminating almost all fat is to me is not a healthy way. It's going to create more inflammation in your body, and you know as a client of mine what inflammation is, right?
Right. I mean, I do on an average 900, and I don't even eat that much. So
Yeah.
to do 500, I would think I would starve myself.
Exactly. So that's not a philosophy here at NAINAMD. I do at least about 1,000. And you know, some patients, if they're smaller, 900, but 1,000 to 1,200, and patients are still losing weight. Because what else do I look at? And what we did with you too is we looked at a lot of imbalances. Are there any other hormone imbalances going on? Are there any? How's the thyroid? You know, looking at it from a functional medicine perspective, looking at your cortisol levels, for example. If you keep going up and down your cortisol levels, that's going to contribute to weight gain.
Right.
Looking to see, you know, if you've got leptin resistance, that's another hormone that's not really checked for. And if you check for it, and it's really high. That's leptin resistance, and that's another reason why you can, you know, get fat. But there's so many reasons. But your, I think, biggest complaint was you just felt flabby, if I can say that.
I felt like heavy, and I wasn't.
Yeah.
But I had this little thing around my stomach.
And now it's like, as you started to change your body composition, you started to feel like, you know, I'm you know, putting muscle mass.
I definitely feel more muscular.
Yeah. And the other thing I think that's important is that hormone, by the way, I won't get into too much of your personal details, but one of the hormones that you were imbalanced, this hormone actually brings the HCG brought that in balance.
Right.
And that's
now
why
it
you
made me
felt
feel
so good.
much better. I was like losing weight, working out, getting muscle mass, and I was like, my mental state was a lot better. I was in a better mood. I was like happier all the time. So I did notice a huge difference with that. So I could just stay on it forever.
So tell me a little bit about what else you think is let's talk about fat. I think in weight loss, it's so important to talk, as I've already talked about, the visceral fat and the subcutaneous fat. Did you, for example, when people say I want to lose weight, you can't just evaporate fat, right? So
well, you have to do. We did some venous treatments, which are really good.
So the whole idea. So the whole idea of that
because you have to break up that cold hard fat,
right?
And so
that is liquefied. So it has to liquefy that, and then it has to go out of the lymphatics. That's the only way. Right. It doesn't evaporate. It doesn't just go out your blood. A lot of people think it goes out your blood. It doesn't. There's a lymphatics. So that means your lymphatics have to be working really well.
Right.
And look at all the women that have had procedures early on in like 18 or 20 when their lymphatics have been cut out for liposuction. Right? A lot of the doctors say, so what? You've just got smaller lymphatics that have been cut off. You still have your larger lymphatics. But anytime you disrupt your lymphatic system, it's a disruption.
Right.
So it's going to affect that. Now you combine that with xenoestrogens, which meaning hormone-driven meats and all of that. Okay. Now you do genetically modified foods like corn syrup, which is the worst thing you could possibly put in your body, and that's created inflammation in your body. You're building up a beautiful, beautiful scenario for weight gain and to be fat.
Right.
In our society, there's epidemic proportions. We are even now oversizing airplanes and buildings. And did you know, I mean, I have to tell you this. I was invited to go see a private hospital in San Diego that is just amazing. They got amazing funding. And they wanted to have me see the state of the art and give an opinion on it.
Right.
So I went there and I saw it was the ICU. It was beautifully done, but the doors were like huge. And I was saying, why do you need such big, huge doors to enter? They said, because some of our nursing staff. And I was like, in medicine, shouldn't we walk the talk? Isn't that sad that we are not addressing these issues? So because no one is looking at that. So going back to that, I gave you actually a treatment that's considered an aesthetic procedure, right?
Right.
But I really gave it to you because I wanted to kind of start to liquefy the fat. There was some stubborn, and so we know now that even if the subcutaneous fat that we can liquefy, that still has a lot of inflammatory substances. Mm-hmm. So I don't see any downside on doing a treatment like the venous.
It's great. It works within one treatment. You see results. If you continue to do it and you keep keep doing what you're supposed to do and work out and eat right, it'll stay off, and it's amazing. Yeah.
And the other thing too about the venous freeze, it's the venous freeze treatment and legacy, and the venous legacy is that it has something called PEMF, which is called pulsed electromagnetic field technology, And again, no one's heard of it. It's like, okay, what is PEMF? Okay, well, it's what it does is it promotes the formation of new vessels. So you get growth factors coming in there, and just what he said about like stem cells, growth factors can come in. That's your own body producing it. Okay, your own body produces it. So you suddenly start to produce more collagen, more elastin. And I think one treatment, a lot of times, a lot of my clients in one treatment is phenomenal. I mean, your one treatment,
like 1 to 2 inches per treatment. It's
phenomenal. It's phenomenal. I know, and people haven't even heard about what venous legacy is. So that's another, I think, a great, a very important thing to add on in terms of weight loss is to do some sort of treatments, and then lymphatic drainage.
Right.
That, okay, now I've got the fat being liquefied. I've got my the heat being built up and everything. Well, then I need to have a proper lymphatic. So there's something called a smooth shapes, which can help, or that helps do the lymphatic drainage.
Or there's a spray that you gave me.
Yes, so there's homeopathic. So I give you like a lymph detox spray. Mm-hmm. So that's believe it or not, allopathic medicine started from the roots of homeopathic medicine.
Right.
Read the history. Check this out, audience, because the doctors will not believe me. Conventional doctors will not believe me. But please check it out. So homeopathic, the lymph detox spray, and I give you a liver detox spray, because if you can process toxins, then you can release all those toxins, and that's going to lower your inflammation. You can lose weight.
Right. It's a whole process.
It's a whole process. And then the other thing is, the wonderful thing is I give you stimulants, but they're non-prescription. Nothing that's going to cause the effect on your heart or your lungs, right? So many like phentermine, you can't use it more than 3 months. It can affect your heart receptors. Those are called the beta-1 receptors of your heart. And then beta-2 receptors are the lung, on your lung. So it can affect that. You can get racy, or you can just feel like, for asthma, as people who have asthma, you can't do that. I mean, it's just all over. It's just not a good idea. I do not give prescription, phentermine. I don't like to. Unless it's 1 or 2 select patients for something, but I just don't like to do it.
Right. I think you have enough.
But I give you nonsense. Yeah. Well, I give natural. So I give natural. I give natural stimulants. And there's things like green tea extracts. There's things like a derivative of a coca derivative. There's things like octopamine. Octopamine is that it's a beta-3 receptor stimulant. It is not a beta-1 or beta-2. So there's so many different kinds of stimulants that can be not harmful, but beneficial.
Safe.
Yeah, they've been used in centuries. For goodness sakes, coffee is a stimulant. So we have used stimulants. So stimulant is a misperception term. Yeah. So thank you so much for coming and really just sharing your experience, because I think it's important for the audience sometimes to hear it from the client side and the client perspective.
Oh,
just
yeah.
We talk so much the science part of it. And for someone to actually, you look amazing, by the way.
Thank
you. Are you working out? Are you working out? Are you?
Yeah, I'm very sore today.
What do you do? What's your exercise
I just do. I do it at home because I have a baby, so I do lunges and
You told
squats.
me about the squats. Yeah, the squat challenge.
I did that for 2 months and lost like 12% body fat within those 2 months. So that was great.
While you were on the HCG and all the yeah.
I just do lunges and squats, and I do sit-ups from the hanging bar.
Oh my
And that's
gosh.
all I do, and I've changed my whole body and my routine.
How old is your son?
He just turned 2.
What's his name?
His name is Jaden.
I would love to have you say hello, Jaden, to the audience.
Hi, Jaden. It's Mommy.
Great.
But thank you very much for having me on. I appreciate it.
Good.
And you're a phenomenal doctor, and I refer everybody to you, because you've helped my husband, my mom, my dad. Very much change your lives around, so thank you.
Well, thank you. Thank you for having, for you coming on. This is Dr. Naina. We'll see you next week with the NAINAMD Fusion of Science and Beauty.